We are in front of the Terry Sanford Federal Building in Raleigh, North Carolina, in front of Senator Kay Hagan's office, just talking with people about the need for health care reform. I'm Kim Yaman, and I'm a grandmother and a mother who lives, and a worker who lives in Cary, North Carolina. I work 2 full-time jobs. I work as a writer and editor for Wake County Public School System, and then I also, because that wasn't enough to pay my health care expenses, I took a second job. The school system's health insurance just doesn't cover as many things as it used to. I face things like a $60 copay for a doctor, plus I pay 20% of the bill, plus I pay a deductible, a pretty hefty deductible each year before the insurance kicks in, copays for the medications. I have a health savings account. Every year I put in $300 a month for that. That's on top of everything else that I pay. And then I have, some money to pay for some of these copays and things. Well, I ran out of that in July, and then 3 weeks later found out that I might have some kind of tumor that was doing some kind of something, and they wanted me to see a specialist tomorrow. And I was like, I don't have enough money for this. Do you think it's really important for me to see this specialist tomorrow? Or do you think I could wait till January? This is a difficult diagnosis to get. But because the first questions that came to my mind were, I can't pay for this. And to have to go to my doctor's office with my 3 credit cards and my FlexCare card and spread them out in front of the financial accountant's office onto the counter and say, I have $60 here, and I have $50 on this account, and I have $170 on my, and I got $4.99 left on my flexible spending account. How much care do you think I can get before January? And it was really hard to go and beg like that and to say, this is how much money I have. What can you do for me? That was a real rough week, because the options at that point are just don't get the care. Do I bankrupt myself and rob my children and grandchildren of everything for an unknown that I'm stepping into that I don't even know if selling my house and every single thing I own and is even going to take care of it? You just don't know. I have insurance. I work 2 jobs. I'm American. I have 17 offers of marriage from people in Europe, in countries that would take care of me just like that. I don't even have to show an ID. I could just go live in somebody's garage in Europe and have this all taken care of, every bit of it. The number of stories that we've heard here today from people. There's this little girl that just stopped here, and she had to go to the doctor the week before last, and they're getting bills that they can't really afford, but they're paying them. And it was just, it wasn't a surgery or broken bone or something. Those kids deserve more. I had spent 6 years taking care of my granddaughter because her mom and dad had been deployed overseas. And so when my granddaughter was 5 weeks old, she came to live with me, and she stayed with me for 6 years. Her mom had a traumatic brain injury from a helicopter rescue in the Persian Gulf about 4 years ago, and she's had, since she came home, she's had 8 suicide attempts, and right now I don't know where she is. She's disappeared in July, August. I haven't heard from her since. My granddaughter has finally, we got a hardship discharge for her dad to come back from Iraq after his 5th deployment a few months ago, and he's to the point now, he needed some recovery time, but in July we sent my granddaughter up to live with him, and it's heartbreaking. But she needs her Nana. She's lost her mom, she's lost her dad for 5 years, and she's not going to lose me. I'm not going down without a fight. Whether anybody here is for healthcare reform with a public option or against it or whatever, we should still be talking. I need care. Everybody here needs care. The bickering has to stop.